I'm literally sitting on a sciatica pillow. Let me show you. Yeah. Feel like I'm 60. If you're watching this video, it's probably because you're having some back pain. You might even need surgery. Like me. I'm just gonna tell you a little quick story of how I hurt my back. 3 years ago, I hurt my back at the gym. To give you a little background, I've been lifting since I was probably 12 and I was in gymnastics. I hurt my back doing leg press at the gym. I thought it was just like a minor problem because it's not the first time I've kind of felt like that because I've always had back problems ever since I was a teenager. It's really sucks that I've had it for so long. After that, I went to squat and I did my first squat just with the barbell and I didn't feel right. And I'm like, okay, no, I need to stop. I'm gonna go home. For probably the next 2 weeks, I couldn't sit, stand, lay. I didn't know what to do with myself because the pain was so bad. It was my whole right leg and my back. I literally do not wish this pain on my worst enemy. After I was able to finally start kind of walking again, I went to the chiropractor, got assessed by him, and he told me, oh, you have SI joint dysfunction. And in my head, I was like, how is that even possible? Because I hip thrust 225, I squat 245. There's no way my glutes are that weak to the point where my SI just like gives out. But I trusted him because he's the physician, like I'm not. I went to him for maybe about 8 months to maybe a year. I stopped going just because I wasn't seeing any sort of improvement. January 2024, so last year, I had my PT friend come over. He's like, oh yeah, like you definitely have SI joint dysfunction. And he gave me like all these workouts to do. I think like 2 months into doing the workouts, felt really good and I saw improvement. Then in December, I had to drive my husband's car and it's really low to the ground. Stretched out my leg fully to hit the gas pedal. The shooting pain just went from my butt all the way down to my toes and it just was excruciating. Was on the couch for like 2 weeks again. Luckily, I could at least sit and feel comfortable, but I could not stand. I could not walk. I don't even remember how I made it back to my apartment. Now that I've been in PT for like a month and a half, I haven't really noticed too much of a difference. I'm still struggling. I still can only stand for like 2 minutes and it's really frustrating because I just want to like walk, like go out on a walk. Finally, like my husband tells me, I think it's just time to go see your primary care doctor. She has me get x-rays right away that same day. My back looks aligned. It looks perfect. Nothing's wrong. Because everything looked fine, she's like, okay, I'm going to send you to orthopedic and meet with Dr. Vo. So I went to go see Dr. Vo. He tells me, well, I actually think that you might have some sort of herniated disc. We're going to have to get an MRI to be for sure. The next day to get an MRI, thankfully it was so quick. I literally got home and I got the notification on my chart like, oh, your results are in. I'm like, damn, that was really quick. Clearly says you have excrusion, herniated disc. It's a large herniated disc. I went to the PT the next day and I showed them my results. They also told me like, oh yeah, like we don't see the word large very often. The times that we do see the word large, it usually means surgery. Don't know if I'm gonna need surgery for sure. I have an appointment on Tuesday to see if I need surgery. I want to capture this because I just feel like this is gonna help someone even though it's not something that I normally post and it's kind of personal. So this is me finding out that I have no SI dysfunction. Everything that I've been trying to strengthen my glutes for the last 3 years was pointless. It's actually a more serious issue. I do have a herniation, a very large herniation from my L5 to my S1. So right above the sacrum, that disc right above the sacrum, that disc is sticking out. Like when I saw the MRI, because the doctor's like, do you want to see it? I'm like, yeah, I want to see it. It's bad. He had kind of like tried to get my hopes up, you know, like saying like, oh, you can get a cortisol shot, but like it might not work. And then he said, also, like we've seen herniated discs like heal by themselves. He's like, but it's a large one. So like, we don't know. And then when I saw it, I'm like, yeah, this is definitely not gonna heal by itself. The disc is literally compressing my stem so badly that it's only about a half. No wonder I've been having so much pain for the last 3 years on and off. I've been trying to mask it with heating pads and ibuprofen. My pain management doctor at the orthopedic department, he actually prescribed me this. This is their oral steroids, but it helps with inflammation. I noticed that I wasn't feeling as much pain. I'm still getting kind of that irritation down my leg, but my back pain is pretty much gone right now. If you don't know about it, make sure to talk to your doctor about it. My primary care doctor actually did give me muscle relaxers. Those make me drowsy. They are so nice for before bedtime because I cannot get comfortable. I'll keep you guys updated. So today is Thursday and I meet with my physician Tuesday. So I had my meeting with my surgeon yesterday, and yes, I will need surgery. It will be a microdiscectomy. I was like, hey, so like when can you get me in? And he's just like, oh, you want to do this ASAP, don't you? And I'm like, yeah, like I'm just kind of tired of like living the way that I've been living. Thank God he is getting me in next Tuesday, so literally less than a week from now. Today I went to my primary care doctor to make sure that I'm okay for operation. I got my blood drawn for labs, and then I also went in to get my back brace that my surgeon wants me to wear after my surgery for the next 6 weeks. Wish me luck. I am a bit nervous, but I'm also really excited from what my surgeon told me because my disc herniation is so large. It's 12 millimeters. Doesn't think that an injection is going to do anything. He did tell me that normally within 6 weeks, a herniation should heal by itself, especially an extrusion. It has like a 80% chance of healing by itself. The immune system attacks it. But in my case, it's already been over 2 months since it like flared up again. On top of it already being 3 years. I'd rather not keep wasting my money and my time and just go for surgery because at this point it's kind of like my only route. So I'm looking crazy. I'm about to shower. It is the day before surgery and I just wanted to share a few things. They gave me this antimicrobial soap and I have to use it tonight, so the night before surgery, and then I have to use it tomorrow morning before surgery. Make sure that you wash your hair, that you like shave your legs, that you do everything you need to do because after surgery I won't be able to shower for 5 days. It ranges, I think it's like 3 to 5 days, but 5 days is max. And you use this, you leave it on for 2 minutes and then you rinse it off. You have to wash your bed sheets, you have to put on clean clothes, you cannot have your pets. It has to be as like clean as possible, like what you can control. No lotion, no perfumes, no deodorant, no nothing. Like you literally have to just be bare. And this just prevents any type of infection when it comes to your surgery. So I'm gonna try to do my best to like really scrub myself well. I'm a little nervous, not gonna lie. I've never had surgery before, so I don't know how I'm gonna react to the anesthesia and just the pain in general. Today is the day, surgery day. You got me some beautiful flowers. Back brace that I have to get for after my surgery, and I have to wear it for 6 weeks. It's not like a Kim K waist trainer or nothing like that, but it'll do, I guess. Sorry for looking a little rough. This is the best you're gonna get because I'm 5 days post-op today. No, 4 days post-op. I had my surgery Tuesday. Yesterday was the first time that I was able to shower since my surgery. On Tuesday when I went in, I was super nervous because I've never had surgery before. I didn't know how I was gonna react to anesthesia or anything like that. The thing I remember was using the bathroom and then her like taking me to the OR. And after that, they gave me some sort of like relaxer through my IV. And after that, I couldn't remember anything. Like it felt like I had 5 shots of tequila. The next thing I remember was waking up in the recovery room. I had no pain down my leg, like no back pain no more and no sciatica pain right off the bat. Like I was able to walk like a couple laps around the hospital, but I didn't get any tinglingness down my toe. I was so happy because I've been dealing with that for the past like few months and like years on and off. So just not having that anymore permanently, that's super nice. And I'm sure a lot of you are gonna like find relief in that. I got there at 11:45 and we ended up leaving at 6 p.m. They had to make sure I had to pee before leaving, and I was struggling a little bit just because like with the pain, it's really hard to relax and like let go of your bowels. Finally, on like my 8th try, I was able to do it. And I know that's a little TMI, but that's just like something that you have to be aware of when you go in. First day back, it wasn't as bad as I thought. I mean, I was on a lot of pain meds. I tried to lower my dosage of oxycodone to 5 milligrams because right now it's a full pill is 10 milligrams, but I noticed that when I did that it wasn't helping. This was like the 2nd day out of surgery and I think I'm just like stupid to think that like I'm superhuman or something and like I could get by with the pain, but no, like you just got cut open. You need to be super patient with yourself. But as of now, I think things are going really well. Today was my first time going number 2. That's also really important. You're gonna be on a ton of laxatives because of the narcotics and everything you're on. Don't bend, don't lift, don't do any of that. If you're able to to have someone take care of you, take that. I only like slept pretty much for the last 3 days. I was just on and off sleeping, but I was on the couch most of the time. If someone's just there to like give you your medicines and like make sure you're eating and all that, like that's more than enough. But I was able to get up to go to the bathroom by myself, but I was able to tuck myself in, doing the log roll method. So make sure you like practice that before you get surgery, because that's probably the most important part. I've been sleeping on the couch. I'll keep you guys updated, and I hope this helped someone out there, because this was like a little personal to me and I was really scared going through this, but I'm actually really happy that I did, at least so far from like my results, because even though I'm in pain, I'm still not getting that sciatica pain. Nothing will ever beat that pain of shooting pain going down your leg versus the incision pain, especially since it's controlled.